In pediatric surgery, we practice family-centered care. The whole family is our patient. We bring them into the hospital, they stay with their children, they stay with them going into the operating room, they're with them in the recovery room as soon as the child is awake. So between the child life specialist and the parent, the child is really never alone. And that allows them to feel safe and allows the family to feel safe.
I ruptured my appendix and I had to get surgery to get it taken out. The nurses have been wonderful. They help out so much, and it's you kind of make friends with them.
Everybody who cares for the child, the surgeons, the nurses, the child life who are involved with the child, really acclimate them to the experience so that it's not fearful.
Defensive back, you gotta be fast for that, right?
They've seen it all before, and I have no reason to be embarrassed or anything, so I can just straight up tell the nurses and the doctors exactly what I'm feeling.
Parents, I'm learning, have more anxieties than the children. They would march bravely into surgery themselves, but when it comes to their child, they're very frightened. I make a practice, for example, of showing the patients' families the CAT scans that I'm basing my decisions on, because they're understandable, and if you understand what I'm looking at, then you understand the decision that I'm proposing, and then there's room for discussion. Pediatricians in the community are very much a part of the care that we deliver. First of all, we rely on them to think of us when the situation is appropriate. And then, of course, when we've made a treatment plan, they're very much a part of it, just like the family. And certainly for follow-up care and post-hospital care, that communication has to be very rich and open.
It really was kind of a learning experience, and how, everyone tries to come together to
solve the problem.
Yeah.
We view our goal as not only taking care of them right now and making sure that they're well cared for at the moment for the problem, but so these children don't fear having a medical encounter in the future. What I found wonderful about coming here was that I could live and work in my community, that there's world-class care available here to children in all areas of surgical care and non-surgical care. It should be reassuring to know that this is really an extension of your home when it comes to health, that when there's a problem that your family needs help with, it's all right here on one campus, very close to home.